My name is Nelson. I'm 52 years old. I reside here in Miami, Florida. I'm from here, Pinecrest. I'm married. I have actually 2 kids from my prior marriage. And from New York originally, born and raised. So for a living, I do hospitality management, which requires a lot of me, which means it's pretty much I'm at work between, 10 to 12, 14 hours, depending on the day. As a hobby, I'm a big golfer. Love golf and fishing, love the outdoors, love camping, pretty much anything that has to do with outdoors. The day of the heart attack, it was about maybe 6:30 in the morning or so. I was getting ready to come to work. I told my wife, hey, I'm not feeling kind of like right, feel that discomfort in the chest. So right away, I kind of knew. I was like, hey, honestly, I'm gonna die. I feel like I'm having a heart attack. That was literally my words to her. Dial 911 because I'm having a heart attack. I got in and they were already hands-on waiting,
Nelson was having chest pain for at least 2 hours before he came to the hospital. At arrival, he was having an anterior wall myocardial infarction, meaning that the artery to the front of the heart was closing down. As a matter of fact, he arrested in the emergency room and we had to resuscitate him. He had a ventricular fibrillation. And we took him to the cardiac catheterization immediately. Because we know that the best therapy for patients like him is opening the artery, opening the main highway, put it that way. And that's exactly what we did.
We kind of neglect everything. You get caught up in the whirlwind, you neglect yourself, To routines like this and things like this, to wake up call. I think overall there was a quick response into the hospital, the EMS, as soon as you got there. From there, being treated, it was amazing.
Our goal is to treat patients who come with heart attacks and get the artery open within 60 minutes. It's actually 2 lesions and involve the branch and the main vessel. First, we put a balloon with 2 wires, wire, balloon, opening the artery, get flow across. Then we put a stent. Once we get flow, we put a stent to cover this. And then we put 2 balloons, 1 balloon in the main inside the stent, and 1 balloon in the branch, and we do what we call kissing balloon at the bifurcation. This is the final result after stenting the LAD and ballooning and kiss ballooning the diagonal. You have TIMI flow 3 in both, but you don't have any blush in the muscle. There's a new form of therapy that is called supersaturated oxygen therapy, in which we infuse through the coronary high flow saturated oxygen that is beyond the concentration of oxygen that you have in your normal blood. We do that for an hour. And now, look at this. Now you start seeing blush. Microcirculation improved dramatically. He was the perfect candidate for this. So we used it, we did it. We were the first in Florida. One of the largest number of cases in the United States. And the patient did fantastically. 3 days later, the muscle of the heart was almost completely normal.
I feel great. Again, I've lost, 34 pounds. When I walked in here, I was 210 pounds. But now, I'm able to actually jog, where before I wasn't. I'm doing 2 to 3 miles, 5 times a week. I incorporated totally different, routine for my way of eating. Today I feel, pretty much, honestly, I would say a good 99% out of the whole process.
Nelson today is doing fantastically. He's totally asymptomatic. His muscle has almost completely recovered, and he has a normal life.
Considering the way I was, this was like a family away from home,
We are at the forefront of technology and the forefront of innovation, and we can provide the ultimate care.
Because of the new process and because it was done so quick, it's the reason probably why I'm here. Pretty much I owe my life.